My diagnosis is bipolar 1 psychotic features, and I have also had a history of substance use. I had actually ended up committing some crimes while I was mentally unstable. I was incarcerated for a period of time.
Walter was a chronic schizophrenic who was this warm and loving man, but he was handicapped enough that he really needed 24/7 supervision.
I was hearing voices at a time when I was out in the community, when they sent me to the hospital, and then Arundel Lodge came and picked me up.
We were lucky enough to find the Arundel Lodge, and it was sort of an answer to our prayers.
And that's when Arundel Lodge first reached out to me. Frankly, I could be dead right now if it wasn't for them.
The arc of the development of Arundel Lodge, probably since 2008 going forward, has been to expand our mission to become a community behavioral health center that could support the needs of anyone in the community and to try to develop programs as the community needed them.
The MICA program, we are working with adults that are diagnosed with a mental health diagnosis and also a chemical addiction. A lot of them have led really difficult lives. They're either coming from a prison or most of them from a hospital. Some were homeless and they come with us. So they've got a lot going on in their past that we need to be sensitive to when working with them and understand that it's a big difference coming from a hospital setting or a homeless setting or a prison into the community.
So the partnership with Arundel Lodge is very special and has gone on for many, many years. And it's always around obviously mental health, but specifically mental health for children. And Arundel Lodge was the agency that stepped up, raised private money and actually opened a children and family centre in response to that need.
People with mental illness deserve the same opportunities that as people who do not have mental illness. Here at Arundel Lodge, we like to educate the community and to decrease the stigma on mental illness.
They have volunteer listings, and it looked intriguing. First, it was a nonprofit. Secondly, there was something called Activity Buddy. What I've learned from my buddy is that we're all different, but we're all the same.
Supporting Arundel Lodge's services, people should come. Residents should come to the lodge. They should see the lightness of it, they should see the paintings on the wall, they should meet the residents and the non-residents of the lodge, and they should understand that at any given time in our lives, any one of us, all 600,000 of us in Anne Arundel County, may in fact, and probably are quite likely, to need short-term or long-term services from Arundel Lodge.
It feels great knowing that I have somebody in my corner that I can go to no matter what the situation is.
I've been sober for 14 months. Frankly, because of their patience and their care, I've been able to get a job, get back into the workforce. They've helped me like every step of the way as far as getting my life together.
There's a lot of good work to be done here. If we had more funding and more means, then we could really reach out to more people and better the programs that we have here.
What we see in our clients are people who show tremendous courage and strength in addressing those challenges. And it's sort of an honor to be a part of their journey.